If you're just joining us, this is Breakfast Daily, and now it's time for us to get into some health talk. You know, it's Tuesday, and on Tuesdays, we love to talk about our health. And remember that this is actually brought to you by the Bank Hospital. So last week, we actually started a conversation, and the conversation was about heart attacks. But we're still, talking about heart diseases. But this time around, we are going to be looking at minimal invasive ways hospitals actually deal with this sort of conditions. And also, I want you to remember that heart diseases are actually some of the leading cause of death worldwide. But the good thing is that, with technological advancement and medical advancements, minimal invasive ways have actually revolutionized the way heart diseases are actually looked at right now, or actually cared for right now. So in the studio with me is Dr. Mohammed Hafiz, who is an interventional cardiologist at the Bank Hospital. He was here with us last week, and this week he's here with us again. Welcome, Doc. How are you?
Good morning, Chris. Thank you so much.
All right. So, Doc, last week we talked about heart attacks.
Yes.
And we talked about, how it happens, some of the symptoms, and who is likely to get a heart attack, and obviously what to do if you think that you are actually having a heart attack, or, having some of the symptoms. But today we are going to talk about, some of the minimal invasive procedures that can be used for heart diseases or heart attacks. So let's go straight to it. What are some of the minimal procedures that can be used?
Look, in the cardiology now, once the patient will have a heart attack and he will reach the hospital, there is two options for the treatment of the heart attack. One medical, and another one this minimal invasive, what you said a few minutes ago. The medical treatment, the success rate is almost 50%.
50%?
Yes.
Of medical treatment?
Yes.
And when you say medical treatment, what is medical treatment?
You give a medication to remove the clot that has blocked the blood vessels for the blood supply for the heart. You give him medication to dissolve this clot.
Okay.
This is one way. Yes. The other way is to take him to the theater, which we call the cath lab, and we will do for him this minimal invasive procedure. This minimal invasive procedure, the success rate is more than 95%.
Okay, so the medical one is like 50%.
Yes.
50%.
Yes.
And the minimal invasive procedures?
95%.
95%.
Yes.
Oof. Okay.
Yes.
All right, so tell us about this.
Yes.
Yeah.
So once the patient will reach the cath lab, he will take a mild sedation, and then he will take local anesthesia. Look, this procedure is painless. The patient is conscious. He will not take anesthesia at all.
Oh, okay.
Just local anesthesia.
Oh, okay.
From the wrist or from the groin.
All right. So when you say local anesthesia, that means your eye is still going to be open.
Yes.
Oh, so you're going to know what's going on around you. Okay.
It's the same like the dentist.
Okay. Yeah.
So you will take the local anesthesia in the groin or in the wrist. Then we use a catheter. This catheter is like a tube, very fine tube. It will enter from the groin or from the wrist till the heart. Then
from the groin?
Yes.
Or the wrist?
Yes.
Till the heart?
Yes. What I want you to know that the pain receptors are only found in the skin. Once you are inside the body, the patient will never feel anything at all, whatever you will do.
Are you serious?
Yes.
So all the pain that we feel is only on the skin?
Yes, that's it only.
Are you...
Anything you will do inside, the patient will never feel anything at all.
So if you put a tube inside me, I'm not going to...
You will just feel the penetration only.
Yeah, just that's the beginning.
Skin, yes.
Yeah.
That's why we put the local anesthesia, to numb this area. That's it only.
That's interesting. But what is this procedure called?
It's called coronary angiography and angioplasty.
Okay, coronary.
Coronary means a crown.
Yeah.
The coronary is the name of the blood supply for the heart. It's called coronary. Angiography means you take pictures for the blood supply of the heart. Coronary angioplasty, now you intervene and you will open these blockages.
Oh, okay, okay. So they're like two procedures.
Two procedures, yes.
Yeah.
And we do them on the same time.
Right, right.
The coronary angiography will take maximum 10 minutes. The angioplasty will take maximum 20 to 30 minutes. So both procedures will not take 1 hour.
All right, so let's check out the coronary angiography on the screen right now.
A coronary angiography, or cardiac catheterization, is an X-ray examination of the vessels and chambers of the heart, often done to identify any narrowed or clogged coronary arteries that are preventing blood from reaching the heart muscle. The study can also be used to measure the size and function of the chambers of the heart and the function of the heart valves. When you arrive at the hospital, an intravenous line will be started. You will be placed on a heart monitor, and you may be given an oral or intravenous sedative to help you relax. Most coronary angiography procedures last between 1 and 2 hours. Before the procedure, you will be placed on a table equipped with a fluoroscope, an X-ray imaging device. During the procedure, the fluoroscope will move around your chest in all directions to record pictures of your heart and coronary arteries from multiple angles. Most cardiac catheterizations take place through the femoral artery in the groin, but can also be done through an artery in the arm. The doctor numbs the skin in your groin area and inserts a needle into your femoral artery. Once the needle is placed, a wire is passed through the needle and gently guided through the arterial system to the heart. The needle will be withdrawn and exchanged for a small flexible tube called a sheath that permits access to your femoral artery. Next, a soft, flexible catheter will be slipped over the wire through the sheath and threaded up to your heart. Your physician will watch the movement of the catheter on the fluoroscope. You may feel pressure as the wire and sheath are inserted, but you will not feel their movement inside your arteries. To evaluate the coronary arteries, your doctor will remove the guide wire, position the tip of the catheter just inside the arteries, one at a time, and inject a special dye. This dye allows the fluoroscope to take X-ray images, called angiograms, of the artery's interior. Any blockages will be clearly identified as the arteries fill with dye. You may feel flushed or slightly nauseated when the dye is injected. After sufficient images of both coronary arteries and their tributaries have been recorded, the catheter will be removed through the groin. Pressure must be applied over the femoral artery to prevent bleeding. You will then be taken to the recovery room for 30 to...
Wow. Wow. So that is the coronary angiography.
Yes.
And so like the angiography is basically seeing what is going on inside you.
Yes.
So what I found interesting is the fact that when there's all this movement, you don't feel anything.
Nothing at all.
You don't feel anything
You
at
don't
all.
feel anything at all, yes.
Wow. So that's dye that is actually injected
Yes.
into, you know, one of the veins in the heart,
Yes.
or, you know, one of wherever in the
Yes.
heart. Is it harmful?
Look, the contrast dye, the contrast we use can affect the kidney.
Okay.
So in the emergency, we don't check the kidney function because it's an emergency.
It's an emergency.
Case. Yes.
Yeah.
But in the elective cases, no, we have to do kidney function
Right.
function tests to check. This is the only harm from the contrast.
Yeah.
But it is very, very, very rare to have something about the kidney from the contrast.
Right.
Very
right.
rare.
Okay. But the angiography goes with the other one.
Yes.
Yeah. So is it possible to do, what is it called?
Coronary angioplasty.
No, angioplasty without the angiography.
Yes, coronary angioplasty.
No, so I'm asking, can you do the angioplasty without the angiography, or you have to do two of them?
You have to see first what you will fix. You have to have an idea for what you will fix. You cannot go to fix what.
Right.
You have to know first.
Right. Okay, so now we've seen the angiography.
Yes.
Can you explain the angioplasty for us?
Yes. Look, now the angiography, we took pictures, we identify where is the blockage. So we go with a very fine wire through this blockage, and then we put a balloon inside this blockage.
You put a balloon?
Yes. And then we inflate this balloon to open the blockage.
Yeah.
So now, once you open the artery with the balloon, the artery is open now, but there is a percentage for the artery to recoil again. So that's why we put what's called a stent.
Right.
To prevent the artery from going
Closing
back
up again.
Yes.
Yeah.
Yes.
Yeah. All right. So we actually have a video about everything he just described. Now let us check out the coronary angioplasty.
Angioplasty, also called as the percutaneous transluminal or balloon angioplasty, is a treatment procedure to restore the blood flow in the narrowed or blocked coronary arteries caused due to plaques or blood clots. Most coronary angioplasty procedures last between 30 minutes to 3 hours. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over the wire and threaded up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope. At this point, the guard wire is removed and the tip of catheter is positioned to enter the coronary artery. A special dye is injected which allows the fluoroscope to take X-ray images of the arterial interiors and help in identifying the position of the block. This is called angiogram. Once the blockage is identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing the flow of blood in the artery. After the blocked vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may also receive a coronary stent, which is a small tube made of wire mesh designed to keep the artery open once it has been treated. A collapsed stent is placed over the deflated balloon catheter as it is inserted into position. When the balloon is inflated, the stent expands and locks itself into place. The deflated balloon and catheter are withdrawn, leaving the stent behind to hold the artery open permanently. Post-treatment, a pressure bandage is applied over the radial artery to prevent bleeding. One will need to lie down for several hours, during which signs of bleeding or chest pain will be monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.
Right. Wow, that's a very interesting procedure. Huh. I think I want to say thank God for, advancement in medicine and technology, yes, because I don't know how this would have been done. So now, when the stent is there, does the stent stay in your heart forever?
Yes, forever, yes.
Forever,
yes.
And it doesn't cause any problems?
No, nothing at all.
Right.
Yes.
So from what I understood, that means sometimes more than one artery is blocked?
Yes.
Wow.
Actually, the blood supply of the heart are through 3 arteries.
So this is the picture of the stent?
Yes.
It's just very small,
yes,
actually.
The maximum length is almost 4 centimeters.
Right.
The diameter is less than half centimeter, less than 4 or 5 millimeters.
Right,
yes.
Right. So like this whole process, right, how long does the process stay?
45 minutes, 1 hour maximum.
Yeah, 45 minutes,
yes.
1 hour. That's with both procedures?
Both of them, yes.
Yeah.
Yes.
And does that mean I can go home at once?
It depends about your condition and the result from the procedure.
Right.
If everything is good, you can go on the same day. But better we discharging the patient next day.
Yeah.
1 night only.
Yeah, to keep you and then
yes.
watch you. Yeah, but who is eligible for this kind of procedure? Who do you think needs this kind of procedure?
Angiography and angioplasty are for 2 reasons. One of them, as we said, the heart attack to save life. This is one. That's the second one is to improve the quality of life. You will find a patient, he cannot do his regular activities. When he will move, he will start having chest pain.
Chest pain.
Yes. So we will open for him the blood supply, this artery, he will have his normal life.
Right. So when do you actually return to normal activities? Like, maybe I like to play basketball. When do you tell me, okay, you can go back to play basketball?
Okay, as we said, if the patient had a heart attack, the recovery period should be at least 1 month.
1 month?
Yes,
okay.
not for the procedure, but because for the heart attack. But if a patient is coming electively, he can, after 2 or 3 days, he can go back to his normal life again.
Right.
He can play sports, he can do whatever he wants.
Right.
Apart from carrying lifts.
Right, yeah.
Yes.
No weights.
Yes,
okay.
no weights at all.
All right, let's talk about the patient's preparation. Maybe the person has come to the hospital and told you, this is what I'm going through, and you check and you're like, okay, you need these procedures. How does the patient go back home and prepare for this? What does the patient need to know before coming back to the hospital for this procedure?
Nothing at all. We just need from the patient to fast at least 12 hours. That's it only.
Fast 12 hours?
Yes, that's
Why?
it only. because of the contrast we are using, sometimes it can use the patient to have nausea and vomiting and like this.
Oh.
That's it.
Oh. But with the second procedure, are there any side effects that we need to know about?
Any procedure or any minimally invasive procedure, sure you will have side effects and some complications, but it's very, very rare. So some patients will have bleeding from the axis you are using. Yes.
Right. So that's the groin.
Yes. Or the hand. Yes. Or the wrist.
You see, I'm learning.
Yes.
I'm sure I can do this in the future.
Yes. This is one thing. Another thing, it can cause some dysfunction for the kidney function.
Right.
From the contrast. This is another thing. And another thing, unfortunately, there are patients who can die from the procedure. But the mortality actually depends upon the condition of the patient, not from the procedure.
Right. So it depends on how you actually came, on how healthy that you are.
If you reach early, everything will finish quickly. If you reach late, it will be hard for you and for the doctor also.
Wow. I mean, you said this last week. You said it's very important to get to the hospital early.
Yes.
Do not waste time if you feel that you have any symptoms of any heart problems or heart attacks.
Yes.
Wow. Wow. Thank you, Doc. But then there are people watching you right now. What are the final words to them? What advice would you want to give to them when it comes to their heart health?
Again, anything about the heart which will come suddenly, you have to rush to the hospital. Don't wait, don't think. Don't try to think it's maybe a chest infection, maybe common cold. No, don't think like this.
Right.
You have to expect what's worse, especially when it's coming suddenly.
Right.
Sudden chest pain, sudden shortness of breath, anything like this, you have to rush to the hospital.
Right, right. Thank you so much. Thank you so much, Doc. Like the doctor said last time, that the worst that can actually happen is that you can actually die from this if you do not get to the hospital earlier. So if you feel any chest pain, if you feel that there's an abnormal activity going up there that you've never felt before, I think you should go to the hospital. And he said, even though these procedures, I mean, the non-invasive procedures actually can save one's life up to 90%. If you still get there late, you won't get that 90%, all right? Sure. Because you must have wasted a lot of time. So the earlier you get there, the earlier that you can, I mean, the better for you, and the earlier you can save your heart. But remember that the Bank Hospital is actually, you know, coming up with an upcoming cardiac camp where you can actually go and check your heart. And especially if you are 40 years and above, hypertensive, and then diabetes, you smoke and you have high cholesterol, or you have symptoms of chest pain, difficulty breathing, or palpitations, you can go to the Bank Hospital. And remember that this is going on from the 2nd of September to the 30th of September. So it's going to be like throughout September. Go out there and go and check your heart. And the proposed test fee is 600 Ghana cedis. And obviously, you can check your ECG, cardio consultation, lipid profile, and fasting blood sugar. It's very important that you go out there and check your heart, because your heart matters. Remember, without the heart, your body definitely cannot function. So without the heart, it's like you're dead. That's it. So it's very, very important to protect the engine of your body, which is the heart. So go out there and go check your heart. Like I said, it's from the 2nd of September to the 30th of September, Mondays to Fridays, 8 a.m. to 11 a.m. Your heart matters. And this is brought to you by the Bank Hospital, okay? Thank you so much, Doc.
So much,
it was really nice having you on the show. I mean, anytime you come, I always learn something new. And I hope that the viewers are also watching and also learning something new, as I always do. But guys, I've been speaking to Dr. Mohammed Hafiz. He's an interventional cardiologist at the Bank Hospital.